Hi, I'm Grace.
Hi, I'm Pierce.
And this is Adjusting to the Curve.
Perfect.
Hey, there we go.
Yay. Okay,
Easy.
so today we have two very important people on. They're going to kind of be talking about clinic and I guess their ideas of clinic, how they feel about it.
Their lives,
Hopefully
all
good
that
things.
all that good stuff. Yeah.
So first we're going to start out with Jared.
My name is Jared Hardina. I'm a current Tri-7. I'm now a student doctor up in the clinic working at Montgomery Health Center. Under Dr. Hewitt. Come see me, please. Things are going good.
Perfect.
Good. Hi, I'm Dr. Merrill Nunez. I'm a clinician and assistant professor here at Logan at Montgomery Center. Yes, and come see us in the clinic.
Yeah.
Jared, I know you're basically done, so thank God for that, man. Because I was talking to my other friend, Amber, under you, and it's just like, Tri-7 is like, you've crossed the finish line at that point. You just got to do the actual adjusting. So with that being said,
Or actually, you started the race, but
you're right, because then you're in practice for the rest of your life.
There you go.
Yeah, see, I'm tuned.
Yeah.
But the senioritis does kick in.
Yes.
Oh, good. I get that again.
It's already kicked in for me. But Jared, as a parent, do you have more of a challenge going through this program, you feel like? Because I know you have a beautiful child. You have a wife.
Two beautiful little
children.
girls.
Two beautiful
They're the
girls.
sweetest little things.
Yeah. No, it's been busy. Because, we moved here May 1st, May 2nd. We found out we're expecting baby number 2. So we're like, shoot, do we just pack up the bags or not even unbox the boxes and head home? But no, we stayed here. She was born Tri-3, week number 3.
Wow.
So right in the thick of things. And so, so now 2 beautiful baby girls. But yeah, I helped start Parents as Chiropractors here on campus. And that's been a great organization. We found a good community now. So we have other parents that we mingle with. Our kids get with their kids. And it takes a lot of a burden off because we have that community. But, I got to do a shout out to my wife. She's with the kids. We don't do daycare or anything. She's with the kids all day while I'm at school.
What a saint.
Yeah.
That's
so,
what I'm saying.
Like, she is unbelievable. So with having kids, the best thing you can do is have that support system. Mm-hmm. And the friends here, like I said, my wife. And no, things have been busy. Mm-hmm. I used to get here at 5:30 every morning to study.
Oh my gosh.
Because then when I get home, I'm just with the girls.
Yeah.
I'm a dad. I'm a husband. Whereas when I'm at school, I get that schoolwork done and get to go home and be myself.
And that's great because that avoids burnout. When you work, you work. When you're home, you're home. You don't mix those. So good job.
Two completely separate things. Yeah, that's good.
So Dr. Nunez, did you graduated from here?
Absolutely.
Correct?
In '88, you guys probably weren't even around then.
I definitely was.
5 days ago.
So whenever you were going through school, did you have any idea you wanted to become a clinician, or what did you
Not at school. It's more when I got into practice.
Oh, okay.
So I practiced for 25 years before I got here to Logan, and so I'm kind of a goal-oriented person, and I kind of divided my chiropractic career into 3. One was my practice, which I did, and I wanted to do it for 25. Actually, I got here in year 23, so a little glitch, but it's good. And then I'm in a second part of my career, which I call mentoring. So it's kind of what I'm doing. And then the third part I plan to do is missionary. It's chiropractic missionary, if possible can. We had the opportunity of clinic abroad here at Logan pre-COVID. And let me tell you, if you ever get the opportunity, you need to do it. Just like you were talking about burnout. Yeah. I saw when we took students and we did some rotations in Costa Rica and also Dominican Republic, which is where I'm from. So I kind of have a place for that. Nice. But the students, I can tell they went from burnout to passion back into it. Because you have to kind of get away from our bubbles sometimes to see what you're actually getting into. And it's amazing.
I think that's one of the things I think about a lot, like the bubble that is Logan, or the bubble that is chiropractic in general. Whether you have friends at the chiropractic schools or you're just going to school all day and you forget you have a life outside of, just school, just chiropractic. You have to, I guess, once you're getting out of it, it's cool to blend the two a little bit because chiropractic is your life at that point. It should be now, but
pretty much.
Jared, with you being in clinic, have you seen any do you think it's changed you a little bit, changed your focus to what you want to go towards, or has grown you as a student doc or a future doctor?
Yeah, definitely always seeing growth. I mean, every day you see a new patient, and it's new stuff that you're learning. But one cool thing is I found out that I've been working with patients from like 18 to 70-some years old. And so you get to see the full population spectrum.
Yeah.
And just having that interaction, like my interactions with the 18-year-old patients, a little bit different than the 70-some-year-old patients. And just being here and getting that interaction and going through that, I mean, that's going to set us up perfect for in the future.
Yeah.
So I want to do a full family wellness practice when I get out of here. So getting this right now has been helping out a ton.
Okay, so I do have something to add to that. So Jared's actually my clinician, and he is, well, I guess my student doc.
Student doc, there you go.
And
Clinician soon.
yesterday I went in, and I was very boring yesterday. I had nothing wrong with me, but a couple weeks ago I sprained my ankle, and he made it all better. So it was so great. So go see Jared, or whoever. Go see your student doc.
And
But-
going to student docs, for students specifically, I know my, like, try one, I think, like, try three-ish, whatever try that was, and then this try, like, I always get to ask because they're students, so I always get to ask them, like, okay, so why'd you do this, or what is this about? And so you learn a lot in there. I remember
It
try one, I was
adds so
learning,
much
like, back to back. I was like,
Yeah.
oh.
And that's what I find in the clinic too. Students that came in and experienced themselves as a patient and try 1 through 6 actually do a little bit better, I think, once they get into clinic, because you kind of know the routine and you ask those questions and kind of find out. Yeah, you learn from day one.
Yeah. If I don't know something, I'm gonna ask questions for sure.
And I found that out too.
So Dr. Nunez sorry.
No,
I
I was going to say,
interrupt you.
well, like in class, we see it from a textbook point
for
of
sure.
view.
Exactly.
Papers,
But
on
when
pictures and
you're
stuff.
a patient and you ask those questions to the student doctors, I mean, we love teaching as much as we can while we're doing our treatments and everything. So you get to see the correlation from textbook to how you actually do it to a patient. So
That's a
ask some
good
questions.
perspective. Yeah, for sure. So Dr. Nunez, what do you think are some things that you want your student doctors to get out of your teaching to them?
Well, the main thing is, just like you guys notice, through 1 through 6, you're getting all the textbook stuff. Once you get 7, it's, like I said, it's the beginning of the race, because now you have all this information in your head. And as time goes on, I mean, I can see a difference in the Tri-7 students from week 2 versus week 5 on how they're learning, but it's collecting, putting things together, and how to apply it. My joy in clinic is when I see a student where they're asking questions because they're not sure yet. They know it, but just don't know how to get it. And then that light bulb goes off, and you can see that the wings are starting to come out. You know, they're doing a little bit better onto it, and that's a joy for me to see that.
I'm sure.
Right.
So.
That's perfect. So ask questions. Don't be
Yeah.
afraid to ask questions.
questions.
Yeah, exactly.
Right.
Always learn.
Yeah.
Right.
Because somebody knows the answer. If they don't know, go to the next
Figure
person.
it
If they
out.
don't know, go to the next person.
Yep.
Jared, last question.
Yeah.
So now that you're, Tri-7, once again, congratulations for making it through all of that with kids. What is something you think you're looking forward to going outside of the Logan bubble, I would say?
Yeah, I think just kind of like what you all said, just getting outside of the Logan bubble. Because when we're here, we're so focused on being a student. We aren't focused enough on being a chiropractor. So that's where, I mean, we've been dabbling in Tri-7 in the clinic, where now we are being a bit more of the chiropractor. So instead of just being a student, we're actually seeing patients, seeing what chiropractic can actually do. Like you said, I mean, fixed a sprain, or allowed your body to heal that sprained ankle with my assistance. And that's something that we don't get to see while we're sitting in classrooms.
Sure. Yeah.
So, I mean, I'm most excited to get out. Like I said, I want to be a whole family practice. So working with infants, newborns, all the way up to 80, 90-year-old patients, and just seeing what I can do or what I can help with through chiropractic.
And and you always try to learn what you can, just not in the clinic. So I talked to a couple of alumni the other day, and they're like, I wish more students would shadow, which is great. Even, informally, if you do that. Like when I was going to school here, I had 2 jobs, working, I call it working, but it was in chiropractic offices, and one was right here in Chesterfield. And I started in Tri too, so kind of a little ahead of the game. And he was more modern, did the modern stuff. And then I did another office I did once a week in the city, and this guy's been in practice for like almost 45, 50 years. So night and day, I mean, he used a dip tank. I don't know, you guys know what a dip tank is? So now x-rays are digitally done. Before they ran automatic.
Okay.
Before that, you had to put them on a frame and dip them in the developer and fixture. But this guy was, I know, so it was like night and day. But what I got out of this guy was the great chiropractic philosophy. And what I got out of this guy was the modernness and how it's improving and growing. And what also was neat is one of the radiologists that worked here at Logan would come in once a week and read his x-rays. So for the week, and then that hour he let me go in our darkroom with him as he was reading x-rays and transcribing them, which is great because it was like a free tutorial for me every year. So I enjoyed, x-rays because of that a little bit. So get out and see, is it integrated I like? Is it, family practice? Is it elderly's only, geriatrics? Do I like the VA system? So just get in what you can and see.
Yeah.
Well, I guess kind of going off of that, what do you think would be your biggest piece of advice to not only students in the clinic, but just students in general at Logan?
Well, we have a neat little poster in the kiosk. The kiosk is that little area where we try to sit with the computers that we put up. I had found it a couple weeks ago, but it shows these circles, and the circle's getting bigger. In the first circle, it said you're in your comfort zone, and then the next circle, it talks about how you're in fear. You're scared. Like orientation week, right? And that's where you're at. And then you want to get to that third circle, which is growth, where you're learning, you're asking questions, you're getting bigger. And then the fourth one is just, which is hard to get to, is where you become an expert in just, experience. But you got to get out of that comfort zone. And one of the things we push in orientation, I was a scout leader for years before I came here. And one of the things we told the scouts, what you get out of it's what you put into it. So I have students that are like reserved, timid, and they don't ask the questions. They don't get involved. They don't have a patient. They're over there studying instead of seeing another case. Doing a secondary and seeing other things. That's how you learn. You got to get out and do it.
There's many ways to learn at Logan or just in chiropractic in general. So thank you guys for coming through the episode today.
Thank you
really
so
appreciate
much.
it. So guys, thank you for watching another episode. Be comfortable being uncomfortable.
Ooh, that's a good one.
There it is.
And go to clinic.
Go to clinic. If you're a chiropractic student, go see other clinics. Shoot, if you're looking into chiropractic, go to other chiropractic offices, come to here clinic, all of that. So thank you guys for tuning in once again, and we'll see you next time.
Bye, guys.
Bye.